I'm Katie Rammel. Alongside me here, Garrett Archer. This is Coronavirus Inside the Arizona Numbers, as we do every single weekday right here, walking you through the best data, the best numbers that are coming out of our state here in Arizona to help you better understand this pandemic. Of course, it's always a progression. It's always changing and evolving, and we're here to help you understand these numbers so that you can make the very best choices for your family and your life. You know them the best. You know their health the best. We're just here to help you make your way through sometimes complicated numbers. And so in the comment section, feel free to ask us a question, and we will help you as best we can find those answers online for Arizona. And if you're watching from somewhere else, we want to welcome you in as well. We've heard from so many of you who are using this information and applying it to the data in your state or your home city. And we hope that that helps you as well. So we can talk about some of the national numbers in there, but for the most part, we concentrate on what's happening right here in Arizona. So Garrett, it is Monday, usually a little bit slower in reporting, if you will. Tuesdays are our big day when we see lots of the weekend numbers come in. But how do things look today? I know people are going to talk about this death number, and so we're going to get to that as well.
So yes, today was definitely a Monday on reporting. So I've got the AZDHS dashboard pulled up, so we'll just get right into it. Today, 163,827 total cases, 3,304 total deaths. The number of cases reported today, 1,813, and the number of new deaths reported today, -1. So I'm going to go over that -1 really quick because it's obviously something that might be confusing to people thinking that there's a Lazarus thing going on. So the AZDHS did put out this morning with today's report that there are instances in which there could be duplicate reporting from a healthcare provider and from a hospital or from a county health that come into the system at the same time and then have to be deduplicated. So, and this looks like this is a situation that happened here, that there was a deduplication from yesterday. In fact, believe it or not, this -1, actually there were a couple deaths reported today, but just when you look at the summary page, it becomes 1. So I'm just gonna click on some of these counties here. You can see Maricopa County, -1 deaths. You can see Navajo County actually did report a death today. Yavapai County reported -1 deaths. Pinal County, -1 deaths. And if I recall, I think it was Mojave. Mojave was the other county that reported a death today. So when you take those -3 deaths and then the 2 that were from Mojave and Navajo, you get up to that -1. If you click on all of these other counties, you can see that the death report for all the other counties is 0. So that is why you see that -1. It might be a little confusing, but it's actually 3 counties recalling duplications and then 2 counties adding death numbers. Again, this actually does happen a lot at the county level. Even on any regular day, it's just that Maricopa County is so large and they report such a large death number that anytime Gila or La Paz or any of these smaller counties recall a death number because of a deduplication process, it's just simply washed away because of Maricopa County being so large. So again, this is not a completely uncommon thing to see -1. It's just uncommon to see it being on the summary page. And because it's a Sunday and we don't have a lot of reporting on a Sunday, this is why you see this.
Yeah.
And no one became a zombie, but I did think that too at first.
Yeah, I know. On the surface, it can look concerning, but when you dive into it and learn a little bit more, it's actually reassuring that they're checking these things so closely and that they work to make sure that the accuracies are reflected there. Jeff Paul's asking about our hospitals. Jeff, hang tight. We'll get to that in just a second. If you can hang with us for a few more minutes, we'll get through this page and get to hospitalization numbers right away because there is some better news on that page as well. Garrett, how do the percentages look?
So the percentages look very good. I'm just pulling up my tracker here at the same time to look at this. But we've had, if you look at that number in the corner, that 14.6, that has stayed 14.6 since July 21st. So for the past 6 days, that number has not changed from 14.6. That is tremendous. That has not happened for a long time. Where the cumulative percent positive has remained the same for so long. As far as the actual percentages for today, what we have is a very low percentage of positive when you look at all the tests. 14.9% when you account for both serology and PCR, 16.1 when you're only looking at the PCR tests, and then again that 14.6 if you try to estimate it or just look at the total number of PCRs. So all in all, very low numbers for today.
Yeah, so it seems, at least on the surface here, that what we're doing is working, and obviously some of those orders were set forth by the governor and set to end. Some of those closures were set to end today, but as we learned last week, they had been extended. So the closures of bars and water parks and movie theaters and gyms are remaining for all of this. And of course, the masks continue, at least for Maricopa County. Should we move on to the hospitalization page, or?
Yes, let's go right there. This is, again, if you've never been to the dashboard, this is how it's laid out. We're going to go first to the full census. So this is all hospital numbers regardless. It's COVID agnostic. It's just simply beds occupied, beds not occupied. You can see we've been sort of in the same place we have been about for ICU ever since July 20th. We've been kind of hanging around this 85, 86%. That's much better than when it was in the 89 to 91%. When we go to emergency room, this is a little noisier of a data set because, as you can imagine, with emergency room visits, the bed occupation, this bed count is done once a day. So, this is a noisier data set. We are up a little bit on this, but as far as the immediate trend, it is down. And then inpatient have stayed relatively steady since the 20th at 3%. And then let's go to hospital COVID specific metrics. I know a lot of people are interested in this. As you can see, this is the inpatient, the general acute care numbers. And you can see that the trend going down that has started on July 13th continues. So we're about 13 days, so 2 weeks of positive trends in inpatient numbers going down. Ventilators going down as well. ICU beds are still going down as well. Discharges, a little noisier data set. You can see this is also going down. Emergency room visits plummeting from 2,000 to 1,189. And then intubations, which is the act of putting in a ventilator. This is a very noisy data set, as you can see, and that's gone up a little bit. So all in all, hospital asset-wise, the hospitals the hospitals are attempting to keep their beds occupied, likely with elective surgeries that needed to be done at some point. But the COVID-19 patient numbers are going down. Now, let me just put a note on that. Of course, these are statewide numbers. So when you see this is basically a general trend for the state. That does not mean that certain areas of Maricopa County or certain hospitals are not still full with COVID patients. There are still certain areas like the southwest of Phoenix that are getting hit fairly hard by this thing. And so their hospitals would still reflect this, whereas some of the other hospitals, possibly some out in other parts of Maricopa County, out in the East Valley, they may be a lot less full than they used to be. So that's sort of the caveat you need to look at these, because I know someone's going to come by and say, well, my cousin is an RN and they say that their hospital is totally full. And that could be the case, absolutely could be the case, but these are statewide numbers. And these are directly reported from the hospital systems to the AZDHS. So this isn't HHS or CDC messing with these data, at least this as much as I understand, is this is a direct report. There is no sort of middle area where it goes to HHS.
Yeah, we've heard from some nurses and other people on here who work in hospitals who have said exactly what you say. But mine is still slammed. But they see this as the start to the light at the end of the tunnel. If things are getting better, maybe in some of the more rural areas, that hopefully that will reflect upon all of Arizona very soon. So we absolutely hope that to be the case. And the declining numbers, no way negate the hard work that's going on for all the staff there. And we absolutely understand that and appreciate what they're doing. And hopefully this will be reflective of everywhere soon. So at the very least, some better news in all of this. And those people who've been waiting on elective surgeries, being able to get back in there, that's obviously a great thing. All right, Anastasia is asking about our R0 number, and it looked a bit lower today. Was it at a 0.96? The site, for those of you who would like to track this, as you know, it's one of the governor's favorite places to track it, is rt.live. We've been telling you about this for weeks and weeks. This site created by the guys who put Instagram together. It's easy to read, red and green, very, very simple page. But I see we have a few more people or states joining us there in the green section.
Yes, I'm going to put this dark really quick just so that we can see the number a little better. You can see right here our not number right now is 0.94, and this does calculate over time. So as you can see, obviously we were talking about how a couple weeks ago it was 1.01, and then 1, and this isn't the daily reported. They recalculate this entire curve every single time. So right now it presumes we're somewhere in 0.94, and this is why, and we'll go up to those, I'm going to bring this back off really quick so you can see the green. And this is why these error bars that are on this are so important. 0.94 is a best guess, but really our R naught can be anywhere between a 7.74 and a 1.13. And Katie, like you said, you can see there are other states now joining the kind of the under 1 category. You've got Florida, Delaware, Vermont, Nevada, Washington, South Dakota, South Carolina, North Carolina, Ohio, and then Arizona, and then better than Arizona as far as their calculated score, Utah, Oregon, Maine, and Texas.
Yeah, so we're seeing more in the green. Obviously, good news. It'll remain to be seen how long we need to keep up with some of these orders in order to get everybody in the green. As we heard early on, when Arizona was sort of the problem child of the states, if you will, that if we weren't in a good situation, the whole country wasn't in a good situation. We could see how fast things could pick up again and could spread again by even just a little bit of travel in there. So we need to see everybody in the green and see everybody within a range that's safer. But for those of you who are maybe just joining us for the first time, this is a measurement of how fast or to how many people this virus spreads at this point. So we want to be below a 1. So that's why the green section, those are all the states that are below that 1 number, and red, those are all the states that have some work to do.
I mean, the easy way of thinking about the R naught number is when you look at that 0.94, it's if there's 100 people in a room, they can pass it to 94 people. That's sort of the best way of looking at it.
Yep. And this is affected by case count, if you will. So it's not affected by deaths or how many people go to the hospital. This is solely dependent on that. So we're obviously waiting for this delay in case results that we've seen, testing results. We've been waiting so long. Let us know in the comments if you are still waiting for a test result. Last week, a lot of you were saying you had been waiting days and days and days. We cannot have that happening. It's too long to wait. It's too hard on your spirit, your soul. It's crushing to wait to find out that information. And we have reporters on this story today. We'll have those, their full accounting of what happened out there coming up tonight at 4, 5, 6, and 10 p.m. But Sonora Quest had a massive delay. At one point, we saw more than 62,000 tests waiting out there to be pushed through. And Andrea's asking, how is that backlog of tests going? So Garrett, how does Sonora Quest look today? Down from 62,000, where are we right now? What's left in the pot to be tested here?
So I have pulled that up as well so we can look at it. This is sort of Sonora Quest's own reporting tool. You can see it might be a little hard to see for some, but the number of pending tests is now at 42,103. So just basically looking at how the numbers were calculated in today, we're still looking at about a 15-day case lag. So there are still tests that were taken 2 weeks ago that haven't been processed yet. So it's still about 15 days, but obviously 42,000, they've made some progress on it. We're trying to, they said that they're going to have this backlog cleared by July 31st, I believe it was.
Yeah, that's right. Friday.
Yeah, we will see what those numbers look like over the next couple days to see if they are able to clear this backlog. Probably one of the most interesting numbers today, and I'll try to bring this in because this is a very important number. And of course, my screen decided it didn't want to do anything. There you go. 7 points. So the daily positivity rate that they sent to AZDHS was a 7.42. That is tremendously lower than what we've seen in our recent numbers. So, I mean, really, epidemiologists want to see a 5% and lower than a 5% positivity rate on tests being sent over to health departments. And they're seeing this at 7.42. So, there's sort of two explanations that might account for this. It's sort of if you're a glass half full or a glass half empty, and it could be a combination of both, of course. One is on the optimist side, it's that a lot of those people that went to that were sitting in line, standing or in the parking lot for 8 hours, they tested positive. So a lot of these 60,000 backlogs will in fact be negative tests and will drive our positivity rate down. And the other thing, which is sort of the negative look at this, is that it could be that these tests have been sitting around so long that we're also seeing some degradation in the samples. So, we don't really know how these tests are being stored. So, I mean, there could be degradation. I mean, Quest Labs is massive. You would presume that there isn't any degradation, but you just don't know. So those are sort of the things you can kind of look at on both ends.
Yeah. I want to stay on this page, Garrett, but answer Marie's question. Are we still sending patients to New Mexico? We had heard of some patients being sent out there. Have you heard of any recently?
I have not. We don't get a lot of information on the non-aggregated sort of numbers here. The only thing I've seen was news reports, and most of those came from the Navajo Nation and from the very, very eastern side of the state, where, I mean, if in this sort of area of the state right here, there isn't, and like this circle right here, there is not a ICU bed for hundreds of miles on this side. For this whole area right here. I don't know where I'd have to look, but the closest ICU bed is probably down here in Safford in Graham. But other than that, if you've got COVID-19 and you require hospitalization on this side, they may have to transfer you over to New Mexico. That's sort of the only thing I can think of as to why that was occurring.
Well, and it would make sense, because if Phoenix was as far away as, say, Albuquerque, it would make sense that they would send you somewhere that isn't as slammed as we were in the last week or two.
Yeah, and it's actually, in many ways, it's closer. If you're in Greenlee and you require hospitalization, it is much closer to be hospitalized in Albuquerque than it is in Phoenix.
Yeah. Some people are weighing in on how long it took. Marion says, I've been waiting 7 days now, and I just saw somebody else post that they've been waiting. Chelsea is writing, she's been waiting 14 days for results. That is way too long for anybody to be waiting. Hopefully we'll get your results back soon, and hopefully it's good news. And Kim was asking, does Sonora Quest still have lots of frozen samples? So that would answer that question on how many they have left in the system there. One of the things that we heard is that those people who were waiting for their answer from Sonora Quest, they received an email over the weekend that stated the frustration some of these places were having with sending their lab results to Sonora Quest and have it just sit there, and that there was a large fight going on about whether they could get your samples back and send it to another place for testing. So we are really looking into all of that tonight. They were talking about sending them to the Northwest, to up in Portland, Seattle area, to try to get it processed quicker. So we have Claudia, our reporter, on that for you tonight. And we'll have everything about what we learned on all of that. Harrison writes, as an ASU student and employee, I got my results back in roughly 30 hours. That's great news.
ASU is very fast. If you get your test at ASU, you're going to get it back within the 72-hour time frame.
Yeah, that's the saliva test. They have one tomorrow for anyone that's interested, out at Cardinal Stadium, I believe. It was on Saturday at Cardinal Stadium. That's usually where they have it. You do need to sign up. You cannot just show up. You'll get a QR code that you can show in your phone or print out. I recommend that you print it out, because sometimes it doesn't scan on your phone as easily. But
I was going to add something. Christoph did ask, what if other states were sending their patients to us? And while it probably hasn't happened for several weeks now, there was indication early on that when Imperial County in California was, Imperial and Yuma at one point was the top hotspot in the country by far. And the case increase in Imperial and Yuma County was just skyrocketing like no other. And so to sort of address what Christoph says, there was at some point some indication that there were places that were sending hospitalizations. Obviously, if you're in Imperial County, Yuma Regional is probably the closest bet for you. So yes, there was at one point a chance that people were sending, other jurisdictions were sending hospitalizations in here. Hard to get this data, but there was a chance of that happening.
Yeah. Let's see. Some more questions coming in. Let's see. Monica writes, my mother-in-law is in a nursing home and they test every 2 weeks. Their results are sent to New Jersey. That could possibly be, yeah, they can be sending them other places to run them. The lab can be in other places. That doesn't mean anything for test results going somewhere else. I'm assuming your mother-in-law is in Arizona when I read this too. She could be in New Jersey as well. But just because they send the lab to a different lab in a different state doesn't mean it's counted in that state. It's still counted here in Arizona as a test for us. Let's see. Someone was asking about blood type. Any information on virus numbers in relation to blood type? Lisa's asking that. I know that they've been looking at that a little bit closer, but Garrett, I don't know that that's been put into any charts or data sets or spreads like that so that people can get a better understanding of this.
Yeah, I would say that as Lisa Ann is saying, it's a report out of MIT. And what you're going to find in almost all cases on that question is it's going to come in sort of those Lancet journals, those white papers that the medical community passes around. You will not see a dashboard, very likely. I mean, I just don't think you're going to see something that says, this patient was blood type A, blood type B. That's data that's collected over time, sort of protected by HIPAA, and will be, right, to study later.
And part of it is because they're not drawing blood at these sites too. Yeah. Unless you're going to get something else done. This is a nose swab. This is a saliva. They're spitting in a cup. This is not a blood draw. So it would be kind of like on a Scout's honor that you're writing down, and that you know what your blood type is. A lot of people, until they go to the hospital or have a baby or something like that, that's when they finally find out what their blood type is. It's just not something people always have on hand. So, but what we have been hearing from some of those studies is that that type A blood was having more severe effects than type O. But there's no, as Garrett said, no specific data that's been out there breaking that down so we can kind of chart it. Gabby's writing, thank you, ABC 15 Arizona, for the COVID update. Gabby, thanks for writing that. That's why we're on here each day, is to just help people better understand what's happening with the data so that you can make the best choices for your family and your life. We get a lot of questions about school starting and some of those metrics they're going to be using. As soon as we hear from school districts that all of you are interested in about their metric or their data point that they are tracking to let the kids back into school, we are happy to help you track that here and happy to help you find that information. So if you hear of school districts that have put forth their plans, let us know, and we'll also hear from Daniel Lerner. So working together, we can answer those questions for all of you, and then also make sure that you just have the best information, that you know where to find it, even when Garrett and I are not here on the weekends. And Garrett, thank you for tweeting out all the updates as well over the weekend. It's always appreciated. And we jump onto your Twitter account. If you're not following Garrett, it's at Garrett_Archer. He does a great breakdown of the hospitalizations, but also the numbers as we see them overnight. And then I generally retweet it. I'm at Katie Rammel. So thank you, Garrett, for that. Some of the other numbers that we've been watching so closely, and I want to get to some of the other questions as well. We hit 16 million cases here on Earth. 4 million, so 1/4 of those are right here within the U.S. The death numbers now are already at 147,000 for the U.S. And as Garrett, you touched on it earlier, 3,304 lives lost here in Arizona. And, we had just a question about that -1 death number just a minute ago, and I want to read it exactly. I want to get to it. Let me see if I can find it here. Tracy writes, Tracy with an I writes, can you help us understand how they're miscounting the COVID deaths, please? It's concerning. They're actually not miscounting it. They're working to deduplicate it. So Garrett, as you were saying, if 2 places are reporting it, they're then going through and matching to make sure we're not counting this person twice.
Yeah, and let me show you something here. And this is kind of, there's obviously there's data coming from different sources, and this is what causes this kind of thing. This is Maricopa County's dashboard from today. And the only thing I'm going to show you right now on this is the deaths number that Maricopa County is reporting right now. They're reporting less deaths than AZDHS is for Maricopa County, and they've reported +4 today. So basically what I'm trying to show you here is that a lot of these deaths, so a lot of agencies are collecting data at any given time, and it's going up to the AZDHS for compilation and for reporting purposes. But things are coming in at different kind of clips. You've got the county health departments, you've got the hospital systems, you've got the healthcare providers that are providing data into the MedSys system. So there's a lot of sources that could in fact report the same death or the same case, and then they have to be deduplicated. So we're seeing this data in real time, sort of, the day it's happening. We're, just kind of imagine an army of epidemiologists sitting at the ACHS, like going through all this information meticulously to make sure it gets it right. And then when they change it up for the next day, there's going to be some changes, and we're going to see it as, like you said today, a removal. We're like, oh, they messed up. Well, they didn't necessarily mess up. They received the same death from 3 different places, and they finally got to the point where they could deduplicate it and put it down, and take down that number 1. So this does occur. This is not something, they don't have 5,000 people doing this. They do have a team of doing it, but a team of people doing this, but we got to cut them a little bit of slack on some of these things, because these aren't errors. These are just processes, and we're not seeing the whole process. So we sort of assume it's an error, and it isn't always an error.
Yeah. Perfect, Garrett. Thank you for addressing that one more time. Shauna writes, a 7-year-old girl just passed away from COVID in Florida, correct? Yeah, 9-year-old. She was a 9-year-old girl, and it was actually their youngest COVID patient that they've had so far. So that is correct. It seems like when I heard this, Garrett, I thought of you over the weekend in that I thought Florida must report more specific numbers, or we're just hearing of this girl's case because I believe it was her cousin, her older adult cousin, who spoke on behalf of the family and shared some really beautiful stories about her young life and how vibrant and fun she was. And so I didn't know if we were hearing the age because the family came forward with this, or because Florida reported more numbers specific to ages, whereas in Arizona, we report 19 and younger, or in some cases on some of our Arizona track sites, 20 and younger. So to give folks a better idea of how many young people we have who are infected with this right now, we checked it for them on Friday, and I believe it was almost at about 18,000 kids here in Arizona. Is that correct?
Yes, I was just doing a quick check on Florida, and it does not seem that they report on age. I can't find it anywhere. So
it must have been that her family came forward, and people always say, gosh, it must be so hard for a family to speak out after the death of a family member, especially, and this goes for anything. This is not just COVID related, but as reporters, what we find is that people really want to share the story of their family members so that they are remembered by more than just a number, that they are all that they were in life is reflected in the story that's told. So we appreciate this cousin having the strength to be able to get out there and share a little bit more about her life, because here in Arizona, they're hearing about it. So what do our numbers look like here?
So as you said, we have a less than 20 years. So 0 to 19 is the number we have. And that's about 19,088 cases. 12% of confirmed COVID cases come from that age category, but that is as far as they break it down.
Yeah, because Danya's asking why 20 for children, why not 17 or 18? That's a number that relates to epidemiology, right, Garrett?
I believe so. That's what I've been told, is that's sort of a risk factor for epidemiology, and so that's why they break it down into those cases. If you want to look at some other, if you live in Yavapai County, Yavapai breaks it down a little farther. You can actually see, I think it's 0 to 12 and then 13 to 17 for Yavapai County. But I believe that is the only county that breaks it out. And they had a very specific reason to do that, because they had a massive spike in cases back in June or early May that came from the Mingus Mountain Academy, which was sort of it's a school, but it's one of those congregate schools. People live there. And so they were like, wow, so many cases, and all of these cases are coming from this age group.
Yeah. Let's see. Drew writes, 3 kids have died from the flu in Florida this year. Did you report on those? No. Drew, let me explain this. We don't report on Florida. We only report on Arizona. Do we report on Arizona flu deaths of children? Absolutely. We report when a child dies of the flu in Arizona. We have always and will continue to report on their death. It sadly is something that we have to keep talking about. It is newsworthy in this case to equate the flu in any way to COVID is not appropriate, but we do report and always have on the deaths of children from flu in Arizona. We'll continue to do that. Let's see here. Let's see. Lots of questions coming. Oh, 147 deaths reported on Saturday. He's not wrong with that. Lorenzo's writing that in.
No, he's not.
That was a big number.
Yeah. So yeah, this weekend, second highest reported number of deaths did happen this weekend, and it was on Saturday. It was 144, not 147. 147 was actually July 18th, but 144. And I did look through that to see if I could. So here's the thing: if the last couple times we've had very high death numbers, the AZDHS would say, well, it's from certificate matching. And well, while that is accurate, a lot of these, even with certificate matching, these numbers are still kind of stacking up in the last 14 days. And that's exactly what happened with this 144, is they stacked up in the last 14 days, the majority of the deaths reported. So this is, even if it was certificate matching, it was in fact because of our higher increased rate from the last couple weeks.
Okay, so where does that put us then for our peak day of death? We've sort of watched that migrate, gets later and later. Drew's writing in. Thank you for asking. Drew, you're so welcome. Happy to answer those questions to help everybody understand that. Thank you for saying so. You're very welcome, and thank you for joining us on here too.
We have actually not, our peak day of death has remained July 7th.
Wow.
This whole time. So that is one thing that has happened, is we have not seen that. July 7th has not changed. It was changing for a while pretty quickly, but it hasn't changed for about a week or two now. So we'll see what happens. We have these right here that are getting very close to 80. But as far as once you get past that to July 10th to the 17th, I don't think these are going to catch up. Just if we have been seeing overall less deaths. So at least, so I'm presuming that these won't catch up, but we will see. So
Garrett, can you read us some of the high totals and the dates there, just for frame of reference? It's so small on people's phones that I want to make sure.
So that's July 7th is still the peak death date for Arizona, and that's with 80 deaths. The next highest is going to be sort of a tie with July 8th and 9th at both 74, as well as July 4th. So all of those were 74 deaths. And then July 10th was 73 deaths. So really, that weekend that week, sorry, the 4th through the 10th, definitely Arizona's deadliest week. We've had a lot of deaths on that week alone. So, and we'll see what happens with these next coming, this next week coming up. Can it still catch up? Absolutely. Like I said, deaths do lag 15 days, but hopefully we're sort of, the modeling should start seeing a lower death number being reported on a daily basis now. We'll see if that actually, shows up.
Yeah, if that holds. All right. Debbie with an eye was just asking, the gyms are closed. Why don't they close the spas inside gyms that are still open for haircuts, massage, mani-pedis? That is close contact. A lot of people have asked this as well. Obviously, this is all up to the governor and what he decides. The case for leaving them open has been that there was 2 hairdressers who were both infected with COVID. They both wore masks. Their clients all wore masks, and they went back and did contact tracing, and not one client got COVID. So that is some better news for the safety of a haircut. I can't speak for a massage or a mani-pedi, but that would sort of be the same application there, that if both people, the person who is providing the service and the person who is there getting the service, wear masks, that can help so much in lowering the spread, and that it might be safe to still keep those places open. So that's kind of been the conversation surrounding that. And then Kimberly asks, producer Carrie's reading my mind. She's already punching it up as I'm reading her name there. Kimberly says, will the numbers go up tomorrow due to this holdover for the weekend? So generally, Kimberly, you're absolutely right. Tuesday is a pretty high number that we see. Garrett, do you have any reason to suspect that Tuesday will be any different? And I think Garrett's shot may be frozen there, or maybe it's my shot.
Something went a little weird. I apologize, but yeah.
You froze for just a minute. I thought maybe my kids went and got on their iPads again. We're all we're all rationing out, as so many parents are who are working from home, who can be online and who cannot be. I thought it was on my end. So
no, yeah. So yeah, Tuesdays are typically always higher because of the lag. I don't see anything changing tomorrow. We'll probably have a fairly large day tomorrow, and I don't want to make any guesses as to how high it's going to be, but it's most certainly not going to be -1.
Yeah, that's for sure. Sadly, that's what we've seen. In looking back, you don't have it jotted down anywhere how the past few Tuesdays have been. I know she could find that.
I can give you that in just a second. So
Yeah.
past Tuesdays, the 21st was as far as deaths, 134.
Oh,
The
wow.
15th was 92. The 7th was 117. So yes, all very high death days. In fact, the highest days of those respective weeks. So, and if you want to see all these, you can actually go to covidtracking.com, and they have all this data downloadable. So you can find this and you can download it yourself and see it, and do whatever you want with it. But you can find it on covidtracking.com.
Yeah, that's a pretty easy site too for folks to navigate. It's got pull down sections for each state, so you can sort of not only look at what it looks like here in Arizona, but you can track it for other states and even do an overlay of the U.S. So when you hear things are ramping up in other places, not in your state, you can sort of see how those differentials look together.
That Amber Lopo is asking the same question. I mean, you can find all that information on covidtracking.com for Arizona, and in fact all the states. You can find their back information. So that is the go-to source for getting all of the archived reporting data.
Yeah, that's a great spot to look. Hey, this day is racing by already, and I don't want to leave without talking about the projections and the models, because there are some things of note in those, both IHME and a couple others that we should peek through today, and also look at the dates for schools on there as well. They can kind of scroll that bar out a little ways and pick a date that might be important to their life. Maybe they've got something planned that day, or they're talking about putting school back in session those days in their particular district. So how do things look on the models?
So I've started with COVID-19 projections. This is the MIT model that I like to use because it is a machine learning model. And you can see it assumes that we are at the peak of our 7-day average right now of deaths. So starting next week or so, we should start seeing a lower average of deaths. Here is the RT number that it believes we are at, which is 0.9. It's actually lower than the one at RT Live. And then here on newly infected, it believes anywhere from 9,000 to 32,000, so about 19,000 or so. But you can see its place on the curve. We're sort of way past our point as far as this model presumes. Currently infected, it believes that about 330,000 Arizonans have an active infection right now. That is without that's what we have in the till, plus whatever hasn't been tested yet, and people who just have active infections, asymptomatic, haven't been tested, 330,000. And you can see
what that's saying, Garrett, is if we have 163,000 cases, almost 164,000 cases, that is the number, that minus the 330, or what is that what you said there, 330,000?
Yeah, so it's about double the number.
Wow.
It's about double number of people at what we have tested and confirmed that are out there with COVID-19.
Wow, that is a big number.
And then this number right here, the bottom number, this is how many people have had the infection. So in total, and that's at 1.5 million right now. That's its best guess of saying, okay, you couldn't get everybody, so this is what that number is of the asymptomatics and those that just stayed at home, didn't get a test, and recovered from COVID-19. Those sort of examples being the larger examples.
Wow. Danya's writing, I'm really concerned about false reporting. We keep hearing this. I would hope this is not happening. I think she's talking about the false positives. Because I saw a comment before. Let me know if I'm wrong in there, and tell me if I'm pronouncing your name right too, Danya. I hope I am. Any false positives that we've heard of, or where they thought that their outcome was not correct. We've heard of only a couple places on the East Coast. So if you're hearing of that specifically, or if you are someone that's happened to, you should reach out to a news organization. But we have not heard of any cases of that happening here. We did hear, like for instance, 90 people had that issue at a senior living facility out on the East Coast, but we're talking about it because it was discovered and it was talked about and reported. But those cases of that, if it's happening, are very, 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 very small. So Jania's saying I'm pronouncing her name right and I got the question right. So hopefully we also got you an answer in there too, Jania. Thank you so much for joining us on here. And if we hear of anything more of it, we'll of course report it on here and bring it up on here. But in Arizona, we hadn't heard of cases of that. Anything else on that chart, Garrett? Or
no, we'll go over to IHME now just to sort of validate to another model. So that was the MIT model. I don't bring up the IHME model that often, but I'm going to today.
I was going to say, it must be a special day. What caught your eye on it? Usually,
I'm just using this because they've done a lot of work on the model, and really it's just to validate. It's validate what we're seeing in the model that I prefer, which is the Yu-Yangu, the MIT model. So right. This is sort of a validation of that. As you can see, the IHME model does also believe that while it thinks that we're going to have another week where we're going to hit our peak, but after that we're going to start going down in all situations of easing here. And then daily testing and infection rate, you can see the exact same thing. It believes that our daily infections, it's still going to keep going down. Hospital resources, it believes that we are sort of at a peak, and we're going to continue to see the drops that we've been seeing. And then that's just a social distancing index that basically where they think Arizonans are going to go. So just this is to bring up just the fact that you look at these numbers and you can say even IHME, another model, also thinks that we are sort of at the other end of this thing. Now, of course, all of this has to be caveated and noted with the fact that, all of this data is taken into consideration. It cannot take into consideration the test lag. This is all stuff that's taken from COVID tracking, taken from the national aggregators. So it doesn't know what our test lag is. So if we continue with processing that test lag and we get some significant spikes over the next couple of days because of that test lag, this could sort of change our trajectory. We just don't know. Where we can find the good news and say, it probably isn't going to change our trajectory is when we look at those hospitalization numbers, because that isn't impacted by the testing backlog, those real-time COVID hospitalization numbers.
Right. Really good stuff. Debbie just asked, do you see numbers in your sleep? LOL, just kidding. I think we see numbers when we're trying to fall asleep, Debbie. That's for sure. Because yes. I know how much, I was just saying, wasn't it on Friday, I was saying to you, Garrett, gosh, I was trying to fall asleep and I looked at that 62,000 number in my brain and thought if 25% were positive, we added that on, and so I think it's when we should be counting sheep, we're counting counts instead.
I'm on 146 days of COVID-19 numbers with no break. So yes, I see the numbers in my head.
Yes, exactly. Let's see. Otto asks, will the schools open like this? At this point, Otto, here in Arizona, it's up to each school district to sort of come up with their own metrics on when they decide to open. That has meant it's a very big job for our reporter, Danielle Lerner, and our whole team that works on education. So we'll be compiling every school district's plans. You can find her Twitter account right there, at Danielle Lerner, or to our website, our abc15.com website, hit /schools. You'll find an interactive map, and you can hover over your particular school district to see either the proposed start date, and this is going to be updated a lot the next few days as schools sort of make their plans, because what's in there now is the start date that they had set. Likely they don't have metrics in there just yet for when they are starting to reopen. So those things are all going to have to be added in as schools make those decisions. And school is starting at our house on Monday. So we picked up iPads today to get ready to get started on homeschooling. So this is the last day of playing in the other room while mom's in here doing this. Let's see. Some other questions I want to get to. Oh, Brant saying, thanks, ABC15. Brant, thanks for joining us on here. We see your name on here often, so we appreciate you taking time with us each afternoon. If there's any other questions, we'll wrap it up for today. Or Garrett, if there's any last words, any last things that you wanted to check.
I did see Martha asking a question about DCS, and I just wanted to let Martha know that I don't foresee us ever having any information from DCS on COVID-19. The Department of Health won't even give us long-term care facility numbers, which is something that's widely reported in other states across the country. AZDHS here has determined that they're not going to give us those, so I don't ever see them giving us anything from DCS.
Yeah. If they do, we'll report it here and we'll share it here.
Report it. Yes.
Yeah. Kristen's writing, HUSD started online today. I know a lot of people are already diving right into the school books. So hopefully it's going well for you at your house, Kristen. Whew, after last semester, that was a lot for moms and dads. That was quite a lot. Let's see. I think that'll wrap it up for today. I was going to see if we got to a few more questions, but I think that's probably a good place to stop as we think of all the moms and dads who get ready to navigate this wild ride. And of course, all the educators and staff as well who are already trying to get back and get things organized for their students, albeit remotely at this point. So let's see. You can find the very latest information on coronavirus. It's right there on our address, abc15.com/coronavirus. There is the very latest info on all of our reports. Anything you might have missed on air, we have it right there. We also want to say thank you to all our viewers who've been watching on other devices. This little chat here has been streaming on Roku and Apple TV and so many different places. So we appreciate all of you that are watching at 7 p.m. or at 11 p.m. Thank you for joining us. And to all of you who've been with us right here along the way. Oh, Anna's writing well wishes to all the teachers and staff. For sure. We echo that. We want to thank all of you who have joined us all along the way, who have made this conversation valuable to making decisions for your family and your life each and every day. If you've got questions, send them to me and we'll try to get them on here one of these afternoons, or you can comment in the comment section. We're usually here about this time each weekday afternoon, or you can find me on Facebook at facebook.com/news from Katie. A lot of you have joined me over there and I thank you for that. Or you can find Garrett's very latest analysis and items on his Twitter account at Garrett_Archer, or my Twitter account at Katie Rammel. So again, those testing delays from Sonora Quest, we have a reporter on it, and that full report will be on at 4, 5, 6, and 10 p.m. and probably a little bit more even at 10, as I mentioned. Otherwise, you can find it online at abc15.com coronavirus.